over WVIP 93.5 FM HD2, New Rochelle, New York. We are America's only Jewish radio program on regular broadcast radio on the internet and digital platforms. Enjoy.
Tonight's broadcast of MD Holistic Healing is brought to you by Vibrant America, providing patients with life-transforming laboratory services. Vibrant America is a leading science and technology company delivering life-transforming laboratory services. Vibrant's vision is to enable symptom-based diagnostics and prognosis for autoimmune disease and other chronic diseases using an integrated microarray platform that would enable multiplex testing at an affordable cost. Founded by technology scientists, our science-driven approach has resulted in numerous products and services in a range of diseases, including allergy, autoimmune like celiac, connective tissue, rheumatoid arthritis, and infectious diseases. We offer a robust menu of clinically relevant tests in various disease areas to accommodate all your healthcare needs. Vibrant America is committed to providing the best services and a clinically relevant menu of testing options to accommodate healthcare providers and their patients. Find out why more and more physicians are using Vibrant America. Ask your licensed healthcare professionals to order Vibrant Wellness Laboratory testing for your peace of mind.
You are listening to MD Holistic Healing with Dr. Raphael Kellman, holistic medical doctor and internist, as well as best-selling author. To reach Dr. Kellman, please call 833-MD-HELP-ME. That's 833-MD-HELP-ME. Visit him online at kelmacenter.com. Here now is Dr. Raphael Kellman.
Good evening, everyone. And tonight we have a great show scheduled. We're going to be talking with really an incredible lab, Vibrant Lab. They're really up and coming, and they're doing great work. I use them in my office, and they really using the latest technologies and providing an incredible service. And they offer a wide range of labs that you're not going to get from your typical doctor. These only you're going to get it from a functional medicine doctor, someone who's looking deeper, who's interested in understanding the causes and why you're getting the symptoms and why you may have a certain disease. So we're lucky tonight to have Greer McGuiness on with us. And Greer is a dietitian, a chiropractor, many degrees. Many of these, I don't even know what they mean, but there's all kinds of letters and all kinds of abbreviations here. There's 1, 2, 3, 4, 5, 6. Well, you'll have to explain what those are all about. She's a certified detox specialist and a certified master herbalist. Learning about detox, we're going to get into this tonight in the show. Greer, she got her master's in nutritional science from Central Michigan University. She's a published researcher on her work with autism and holistic functional alternative medicine, as well as autism and toxic exposure. She's also trained in herbal medicine, how to use different herbs and food to support the body's ability to heal and to rebalance itself. Greer is an expert in food sensitivities, gut health, and detoxifying heavy metals and environmental toxins. And believe me, that is a big problem. And that's why this show is a very important show. I would even advise you all to record it, because it's to share it with people, because it's going to be really quite important and very relevant. So Greer specializes in pediatrics with a focus on functional medicine with autism and ADHD. She's a New Yorker and enjoys spending time with the family, which is wonderful. We have a very family-oriented listenership here. She's a researcher and enjoying the outdoors. So really welcome, Greer. It's so nice to have you.
Thank you.
I'm a big fan of Vibrant Labs. We started using you guys a few months ago, but I can tell you that we're going to be using you more and more for all kinds of different tests that you offer. So let's talk about the environmental toxicity, all the chemicals in the environment. What types of chemicals are there in the environment? And what we should be aware of, and what do you do about it? I just want to say that although your specialty is in autism and in children, but you have a wide range of understanding that is equally applicable to adults with a wide variety of symptoms and conditions. So that being said, so tell us about, the toxins such as heavy metals and other environmental toxins that are in the environment and why it's such a risk and what kind of diseases could they cause?
So yeah, it's actually a pretty staggering number where the moment you wake up and you walk outside, you're actually exposed to over 700,000 chemicals. Like the moment you step outside, that's how many toxins that you can be exposed to as soon as you're getting in your car to go to work or you're getting in your car to take your children to school. So there are so many different types of toxins. We have heavy metals, we have pesticides, what we call volatile compounds, which is your gas fumes, solvents, phthalates, products that we use on our skin and our body, or even cleaning products. It is an array of, just an array of toxins that that many of the times that you don't even realize that you're coming in contact with, whether you're sleeping on flame retardant bed sheets, or you're sitting on a couch that is been dipped also in flame retardant and chemicals. So it goes down to the dust that's in our home. It goes everywhere. So it's something that what I call fills the bucket. Each individual toxin has been looked at to some degree individually as to quote unquote not be toxic or not be life-threatening to a human to a certain extent. But when you combine all of these toxins together, it's basically filling the bucket to the point where the person who comes to you is sick, they're tired, there's something that overflowed that bucket for that person, whether they have joint pain, muscle pain, migraines, asthma. We've seen anything from eye floaters to earaches, constant earaches, immune system responses, cancer, all these different types of diseases that can come about, Hashimoto's, autoimmune issues. All of those can be triggered by underlying environmental toxins.
And what types of toxins are most prevalent, and where are they coming from? So you mentioned toxins, you mentioned environmental toxins and metals. So what are these top few compounds, metals, toxins that are in the environment that are causing so many different diseases?
I definitely see a lot of mycotoxins, so mold. I mean, about 70% of homes will have mold exposure to some degree. Also, people who consume foods that are moldy when they don't even realize it. So mold is actually a very underlining, what I call very invisible illness. You have tons of heavy metals. I mean, about 180 million people drink radioactive water. So that's anything from mercury, arsenic, aluminum is in our water. I've seen uranium.
What do you mean by radioactive water?
So radioactive water, meaning any radioactive compound, heavy metal, can be in water supply.
Are the heavy metals, are you calling them radioactive material?
No, so only certain ones like uranium,
right.
Cadmium, things like that would be the radioactive pieces, but we're also consuming heavy metals regularly in our water supply. You have pesticide exposure, which when I test people, I mean, they are just filled with all different types of pesticides. Typically a lot of more that I see is phthalates and parabens too. And I think it's because of what we've used as products on our body and skin for so long, and now we realize that it is a problem now. Then it, people like women who I've had patients with Vibrant who are in their 40s and 50s, and they test high for parabens and phthalates, and they say, well, I haven't used those types of products for 5 to 10 years. Why is this still coming up? And I say, well, for the first 30 years, you used 7 or more of those products every single day for 30 years. So your body can bioaccumulate toxins at such a high rate for so long that
And they're not biodegradable. Many of these toxins as well.
Yeah, and that's there's half-lives, like certain pesticides and things like that do have half-lives, but the problem is if the person's not detoxing and you're taking in a large amount of other types of toxins, I find that it doesn't get a chance to actually biodegrade to that extent to leave.
Right. Now, the flame retardants that you mentioned, are they like in pillows? Are they where in the pillows? Are they in the inner material of the stuffing of the stuffing of the pillow? Is it on the covering of the pillow? Where would they be found?
So for flame retardant items, depending on the pillow, they can be made in the linen part. And then also like your sheets. A lot of bed sheets itself will be dipped in flame retardant, no different than pajamas will also be flame retardant. So that's why it's important to buy 100% organic cotton bed sheets and pajamas, because that's what you're breathing in and sleeping on every single night.
So even, let's say, the expensive sheets, you're saying they can have flame retardants in them?
Yeah, even the expensive one, if it's not 100% cotton, then typically it will be some type of chemical that will have some type of PCB or some type of like flame retardant.
But if it's 100% cotton, then it won't have flame retardants in there?
No. When they're 100% organic cotton, they're typically not dipped or sealed with anything.
Does the cotton have to be organic, or just that it's just completely
most of them will be, honestly. I've gone up and down the aisles of Bath and Body Works or Bed Bath and Beyond and stuff like that to look, and pretty much anything that says 100% organic or 100% cotton will say organic on it too.
That's not my experience. I mean, the people who are selling organic are making that statement, but I thought that there are many companies that have 100% organic, cotton sheets or cotton pillowcases, but they're not, or they don't mention state organic.
Yeah, the ones that I've seen most will say 100% organic cotton, where I'll read, and usually when you look at the labels on them, they will actually say if they are flame retardant on them as well.
Oh, they would actually state that?
Some of them do state that on the back because it's kind of like I guess for some, it's like a selling point.
I see. So let me ask something. So let's get to the metals, right? Where are people getting these metals from? And, how are we exposed to them? Where are they found? Lead, cadmium, mercury. I know mercury from fish, but let's say lead, cadmium, even thallium. And, even those who are not getting MRIs with, dye, or CT scans, I'm seeing high levels of things like thallium and so many other heavy metals. Where are they coming from?
A lot of metals will come from our water, depending on your state. I've seen, when I work with patients from all over, and I get to see, especially with Vibrant patients, we use ewg.org a lot of the times to check where their water supply, and if they have high amounts of types of heavy metals. I do find a lot of it does come from their water supply, whether it be from their really old pipes that they have in their home too.
Well, what about if you're drinking filtered water? There's so many different companies that are selling filtered water. There's also bottled water, glass. It's in glass, like we get from Mountain Valley. Is it guaranteed that there aren't going to be heavy metals? For myself, it's very metals, and I had high levels, and I drink, purified water, filtered, and then from Mountain Valley, and like, where's it coming from? I basically eat organic, and I see this time in and time out that many people are still having high levels of these metals, even though they're not drinking the water from the tap.
So it depends on the metal. So certain metals will stay a lot longer, like aluminum can stay in the brain for up to 10 years. Cadmium can stay in the bones for 30 years. So a lot of it could be.
What about lead?
Lead does have a very long very long life too. I believe it's anywhere from 10 to 20 years between the body and the bone. A lot of heavy metals go and they will stay in the bone as well.
What about the brain? What about the brain?
I want to say the last time I looked this up, it was about 10 to 12 years was, and these are based on old research. There's nothing new yet that says like how long lead can stay into the body and the brain. But you can get heavy metals not just from the water, but your dust in your house and your home actually has been shown to have high levels of heavy metals, especially that's why I always say take your shoes off before you walk into the house. Don't track in any type of dust and heavy metals. Aluminum pots and pans, don't cook with aluminum foil. Could
you heat things up in aluminum foil?
I don't know. No.
So what do you use instead of aluminum foil to heat things up?
Like on a grill, you can actually most people use just a cast iron skillet. I have cast iron skillets that I use as well to heat things up. You can get like sheets, almost like a baking sheet where you could heat things up. So aluminum foil a lot of times was more or less to protect the whatever you were cooking in, so you don't get grease and stuff all over. And for me, if I get greased on it, I get greased on it. I just wash.
Well, also to hold in the heat, some people use the aluminum
foil.
Yeah,
you can. I mean, I don't use anything, if I'm cooking, especially something on the grill, you can get like a grate thing that holds it on both sides and flip it and things like that. So I just really don't use anything that I need to cook with aluminum foil with.
Even to keep things warm or warm up food or keep food warm, you wouldn't recommend wrapping it in tin foil, aluminum foil.
I don't know. I don't even have it in the house.
yeah, I agree. I mean, I think it should be thrown out. I mean, especially aluminum has been associated with Alzheimer's disease, which we know is on the rise. So aluminum really should have no place in the kitchen. So I agree with that. So in other words, that you could have high levels of lead and other toxic metals, even if you're not, you're drinking purified or filtered water. So it's something that people should test. And your lab, Vibrant Labs, has incredible testing for it. But before we get into the testing that Vibrant Labs offers for the chemicals like pesticides and mold and lead and other heavy metals, what diseases could they cause? What diseases and what symptoms? Let's get very specific.
So, I mean, that can be, what's interesting is a lot of any type of toxin, whether you're dealing with environmental toxin, heavy metals, or mycotoxin, their symptoms and their disease states can all be very similar. Where especially something mold, I've had patients come in with some really crazy symptoms, and when we do a toxin test, we find tons of mold, and all they had was severe back pain. I've had one woman with eye floaters, so one person with ringing in their ear. So I wish I could say like this one particular toxin can cause this particular symptom, but there is, I've seen heavy metals with PCOS, irregular menstrual cycles, early menopause, Alzheimer's, autism.
With Alzheimer's, which metals do you tend to see?
I see high aluminum, high mercury, and I have seen a little bit more of things like uranium and cadmium.
What about lead?
I've seen lead a few times, but I haven't seen a huge trend. But again, I don't always get those cases. So, I can definitely see where that is coming from. The issue is a lot of the times doctors will be testing for lead exposure in the blood pretty frequently, especially with people, the kids under 1 and then in older adults too. So usually lead will be caught pretty quickly if it is a lead toxicity.
Right, but no, this is a very important point here, that what's in the blood has really little to do with what's stored in your tissue, right? When you check the blood, that's an acute exposure, meaning you just got it in the last week or two. But what about what's something that you've been accumulating over the last 20 years? And it's not an acute exposure, but it's just something that's been accumulating over many, many years, perhaps in your childhood, which goes back, could go back 20 years, 30 years, 40 years, right? Or even more, 50, 60 years, who knows, 70 years. So what type of test would be best for that? And does it depend on when you may have been exposed to metals? And what type of tests do you offer to test for these types of toxins?
So yeah, so you are correct where lead does have a little bit longer of a half-life and does kind of circulate in the blood a little bit more than other heavy metals. And that's why they do a blood test for lead. But you are 100% right where we do a urine analysis, which is gold standard for testing for heavy metals. So that's what we use. And that is kind of looking at right now what is possibly in your system at this very moment with heavy metals. So that's the urine test. Other testing like blood will not show you a current exposure or even a past exposure if you don't really know, or if your body metabolized it or it went and found a home someplace, because heavy metals love to hide. And that's why I think that they pretty much cause the diseases that they do. They go right to the brain. They love our lungs. They love our kidneys. They love our liver. They love our reproductive area. And that's why the diseases that they cause are honed into those specific organs, because that's where they love to go and find a place to call home and disrupt the system.
So what test, your Vibrant Labs offers intracellular levels of metals that you actually look into, I believe, the red blood cell, and to see if there's accumulation of various metals. What is that a reflection of exposure when?
I think you're referring to the micronutrient panel, which is our intracellular and extracellular. We don't have a blood test.
Oh, you don't do, I know you do a urine, but do you test metals in any other way besides urine?
No, just urine right now. I don't know if there is anything else in the works, but I do know that if we're concerned, I also do recommend a micronutrient test, because there are many times where if you have a high copper zinc ratio in the person's blood, that can indicate heavy metals.
Okay.
So there are times where I will also use, and I know that sounds odd, but micronutrients can actually show us if there's a potential heavy metal exposure as well.
Okay. Yeah, that's true. Let's take a break so people can hear a little bit more about Vibrant Labs. And I just want to tell you all that I use Vibrant Labs, and I'm really seeing incredible information, incredible results, and it's quite elucidating and shocking. Okay, let's take a few-minute break.
Tonight's broadcast of MD Holistic Healing is brought to you by Vibrant America, providing patients with life-transforming laboratory services. Tonight's broadcast of MD Holistic Healing is brought to you by Vibrant America, providing patients with life-transforming laboratory services. Vibrant America is the leading science and technology company delivering life-transforming laboratory services. Vibrant's vision is to enable symptom-based diagnostics and prognosis for autoimmune disease and other chronic diseases using an integrated microarray platform that would enable multiplex testing at an affordable cost. Founded by technologist scientists, our science-driven approach has resulted in numerous products and services in a range of diseases, including allergy, autoimmune like celiac, connective tissue, rheumatoid arthritis, and infectious diseases. We offer a robust menu of clinically relevant tests in various disease areas to accommodate all your healthcare needs. Vibrant America is committed to providing the best services and a clinically relevant menu of testing options to accommodate healthcare providers and their patients. Find out why more and more physicians are using Vibrant America. Ask your licensed healthcare professionals to order Vibrant Wellness Laboratory testing for your peace of mind.
Have you been diagnosed with an autoimmune disease, rheumatoid arthritis, lupus, Hashimoto's, or colitis? Are medications not working or causing side effects? Dr. Raphael Kellman, an internist and pioneer in holistic functional medicine, finds the root causes of these problems and heals them using natural treatment methods. His approach has reversed diseases in thousands of patients, and he can help you too. Call the Kellman Wellness Center at 833-MD-HELP-ME for more information about how Dr. Kellman can help you feel your best. That's 833-MD-HELP-ME. Learn more about the Kellman Wellness Center at kellmancenter.com. The phone number again, 833-MD-HELP-ME. That's 833-MD-HELP-ME.
Okay, well, welcome back. I can help you by doing testing like from Vibrant Labs. So, we're always looking deeper, looking for causes. I think that's the way medicine should be practiced, to look for causes. We see this all the time, that there are causes. When you develop an autoimmune disorder or dementia, neurological disorders, when you catch, it's so important to catch these things early, or more importantly, and equally important is to test even if you have no symptoms. But early on, if you have any of these symptoms, it's so important to do these tests that really could evaluate for the causes of your problem. So looking for causes is paramount in the practice of good practice of medicine. So by the way, this is Greer McGuiness. Did I pronounce your last name right? McGuiness?
McGuiness, yep, like
McGuiness.
The beer.
She's one of the scientists at Vibrant Labs. Vibrant Labs is how old is Vibrant Labs now?
I think they're about almost 6 years now.
6 years. They're using incredible technology, very advanced technology that can detect so much, sometimes with just a finger prick of blood. And it's amazing how much they could see in just a minuscule amount of blood. It's just incredible. It's mind-boggling. And by the way, folks, these tests could be sent to your home as well. And you could do the finger prick. It's no big deal. And from that little finger prick, you can get incredible amounts of information. I believe many of these toxins between urine and a small amount of blood, you can see all these different toxins. Is it a urine or a blood test?
So we have something called the total tox, which is
Right.
heavy metals, mycotoxin, and environmental toxin, and that's strictly urine. So it's super, super easy. We can even take from a newborn. It's super easy to be able to get a sample for people to test.
And they have to order it through the doctor, though. They can't just get it.
Correct. You do have to have a licensed practitioner to order for you.
Right. And certainly you could call our office and we could send you those tests, and then we could discuss it with you and evaluate them for you. If you do, let's say, an allergy test or a food sensitivity test, you could just see the results for yourself, and you don't even need to see the doctor. But we just have to order it for you. So I have an interesting question. I tested myself. I did this test, by the way, the total body burden toxins. And I found high levels of Roundup in my sample, which was shocking to me because I try to eat only organic. My water is filtered, and I was shocked to see that Roundup, which is a poison, and it's a pesticide that has been implicated in a wide variety of diseases, including cancers and neurological disorders. I believe autoimmune disorders as well. It should be taken out of our food, but it's not. So how would I have had such a buildup of Roundup?
Yeah, so I get asked this question a lot because a lot of people, don't use those products too, because we know that it's toxic and it's poison, and we don't want anything to do with it. So, and here's a great story. I walked out of my house the other day, and my neighbor had Roundup in his hand, and he was sitting there just spraying all the dandelions in the front of the yard, literally right across the street. So that in the air. People don't understand that air pollution, runoff water, walking, that could go right onto your grass, that could go right into the air, which is if you have your windows open, that goes right into your home. Now, these particles are so minuscule. The microns of them are so small. They go right into the lungs and they can bypass and go right into your bloodstream. So a lot of it can be from the air. It can be from the ground that, if you go to a park, if your kids play baseball or soccer and you're on the fields, the likeliness is that they do spray and use pesticides or herbicides on those areas as well. And a lot of times it can be from our water too. So I know many people do have filtered water, which is great, but not everybody does. Your clothes, if you're outside for the day and someone's spraying pesticides or you're in the ground, that's on your clothes and that's also being absorbed into your skin as well.
So do you see this commonly, that even though someone may be eating only organic and filters their water, they can have high levels of Roundup, glyphosate?
Yeah, glyphosate is one of the toxins that I see most common because it is used. I mean, the amount that is used per year in the United States is in billions, almost trillions. I mean, we use a ton of it in the US, not only just for agricultural, but also personal use. So it's almost one of those things that is unavoidable just because of the amount that it's being used.
Yeah, no, it's really incredible. So let's talk about, by the way, glyphosates is the other name for Roundup, or actually Roundup is the other name for glyphosates. And there's been a number of lawsuits, but they have so much money, they could take all the lawsuits in the world and it wouldn't matter. But yet they've lost a few lawsuits, cancer, lymphoma. Patients with developed lymphoma, they proved that it was related to it, and they lost. But it doesn't make a difference to the who actually owns produces Roundup. Is it I'm forgetting the name, but it's owned by
Bayer.
Maybe, but it's owned by companies even higher than that. So what do you do in terms of detoxing? What could the average person do to detox these chemicals and toxins out of our body?
So I usually start with something that I call my 4 pillars of detoxing, which the first one is filtered water. That is one of my biggest ones that I talk to all my patients about, because when we start realizing, I mean, like I said, I work with a lot of kids on the spectrum, and when we test their waters, and I've tested their children, I mean, I see high levels of arsenic, mercury, aluminum, cesium, cadmium, tellurium, uranium,
and lead.
Yeah. And it's kind of one of those things that, I say, let's just start with 4 basic principles. Let's get clean water, clean food, clean products, and clean air. So
with clean water, what do you recommend? What types of filter do you recommend?
So, depending on your home, obviously, if you could do a whole house like reverse osmosis system, people love those and find that they are one of the better options just for time management, consistency, so you don't have to worry about, is it the sink, is it the refrigerator, is it the bathtub, because kids take a lot of baths and you're going to absorb a lot of toxins right through the bath water or your shower. So
reverse osmosis has its own problem, its own associated with it.
Yeah, you have to remineralize the water with reverse osmosis, and that can sometimes be a problem. There's a lot of AquaTrue has a water filtration system. There's so many different ones that I've researched over time and just try, it's really dependent on the house and what you could do. Like a Berkey is great as well. If you can't do a big counter one, you can get a on the counter just pitcher that you could pour. There's so many different ones that are out there to make it easy for patients. And
what would you recommend an under the sink filter if it's not reverse osmosis? What company would you recommend?
That one, I'm trying to remember the name, and I just bought it too. We just installed it, and the name is completely escaping me.
Aquasana. Have you heard of Aquasana?
Aquasana is one. Aqua True is the other one that we just bought as well, because we did have to buy. We didn't have enough room for a reverse osmosis in our basement, so we had to do the Aquasana. We did an Aqua True. And then I was looking up a couple different ones for the shower head and things like that too.
So what about Mountain Valley water? What are your thoughts of them? That comes from us. They say that they test for metals and they find nothing, and it's given to you in big glass bottles. Have you heard of that company?
Yeah, I've had a couple people that practitioners that absolutely love it, and I haven't read anything terrible about it, as long as it's in glass and it's not coming from plastic.
Okay.
That's always like a big thing for me, is anything that's coming in plastic we don't want. So if it's coming in glass, it's trying to find a company sometimes that does that independent research. So what you're looking for is the removing of all these different types of toxins from the water. So you'll get some that say only remove 70 contaminants. Well, that's kind of low versus like a like Epic pure water filter removes over 300 contaminants. So, it depends on the cost. I mean, these can be costly. Remember, people have to change their filters a lot, and that could be a little bit costly for them as well. So, I mean, Clearly filters are great. Those are amazing. Pure faucet filtration systems are really great.
Is that over the counter? What it's called?
So Clearly Filtered is a filtering system. It's a 3-part system. That's the one that I bought for underneath my kitchen sink. They do make other ones where it's just like a water pitcher, which is from Pure too. They make just like a water pitcher if you can't afford. I mean, because some of these again are like $500-$600, and then you have to replace the compartments every 6 to 9 months, depending on how long they last.
So you like companies like Clearly Filtered or AquaTrue or Aquasana, right?
Aquasana, yeah, AquaTrue, Aquasana, Berkey makes a great on-the-counter water filtration system as well.
Now, so okay, other than cleaning your water, drinking clean water, what other ways can you remove heavy metals and toxins? Are there certain supplements that people could buy? Food?
Yeah. So I mean, trying to eat organic is always better, but it doesn't, just because something's organic doesn't mean that they don't use pesticides on it. So I always tell my patients you try your best to buy organic, or at least follow the clean 15 versus the dirty dozen types of fruits and vegetables, and then make a baking soda bath at home and wash your fruits and vegetables to try to get as much of that pesticide out as possible. Air filtration systems like the Air Doctor, Blue Air, things like that, because like I said, a lot of heavy metals, phthalates have been found in 100% of dust in the house. So those toxins are always in the air filtration system. So getting a good air filtration system. So products, I'm a big advocate for good, clean products, and trying to find, supplement brands that are good, products that you use on your body and your skin. Those are all really important for me. So I'm always trying to find the best products for my patients. And I usually try to work with them with checklists of just going room by room and swapping out and learning about a different product. So when you get done with your body wash, research and let's find a body wash that is a good, clean body wash for everybody. And then we carry that over.
Do you think chlorella or cilantro could really detox heavy metals out?
So yeah, they're depending on the heavy metal. So not all heavy metals are the same, and not all heavy metals bind similar to mycotoxins. So a lot of them can help The research on certain ones, I'm actually putting in a list together based on clinical research of which supplements bind to which specific heavy metal individually. It's taking me a long time, but I'm getting there to the end of my.
So what's the big one? What are the best supplements that can help with detoxing metals and mold?
For heavy metals, I love zeolites.
Zeolites
are one of my favorites. I use liquid zeolites a lot to bind heavy metals because zeolites are positive ions so they're attracting positive ions, and heavy metals are positive ions. So that's basically what it's attracting. So it literally can go throughout the system. It's an aqueous solution. So it's very mobile within the body, and it goes and it attaches.
Is there a particular company that makes zeolites that you recommend?
Yeah, I love a company called TRS Cosima.
Yes.
I love that.
I use them too, and I see good results. Totally. So what are your thoughts about cilantro and chlorella?
I do use them in my practice, and I'm actually I use it for myself too to help, because what I find is if you have a patient when you're detoxing them and you've maybe tried zeolites or you've tried fulvic and humic acid and maybe some other things, and they are super sensitive. They just detox really hard, or they just don't feel well when they're on those supplements. I will start them on cilantro or chlorella or something less, harsh a little bit, I want to say. So it actually can prep the body and help just kind of get those systems moving without shocking the system too much.
Okay, let's take a break. We're talking to Greer McGuiness and from Vibrant Labs. We'll be right back.
Tonight's broadcast of MD Holistic Healing is brought to you by Vibrant America, providing patients with life-transforming laboratory services. Vibrant America is the leading science and technology company delivering life-transforming laboratory services. Vibrant's vision is to enable symptom-based diagnostics and prognosis for autoimmune disease and other chronic diseases using an integrated microarray platform that would enable multiplex testing at an affordable cost. Founded by technology scientists, our science-driven approach has resulted in numerous products and services in a range of diseases, including allergy, autoimmune like celiac, connective tissue, rheumatoid arthritis, and infectious diseases. We offer a robust menu of clinically relevant tests in various disease areas to accommodate all your healthcare needs. Vibrant America is committed to providing the best services and a clinically relevant menu of testing options to accommodate healthcare providers and their patients. Find out why more and more physicians are using Vibrant America. Ask your licensed healthcare professionals to order Vibrant Wellness Laboratory testing for your peace of mind.
Have you been diagnosed with an autoimmune disease, rheumatoid arthritis, lupus, Hashimoto's, or colitis? Are medications not working or causing side effects? Dr. Raphael Kellman, an internist and pioneer in holistic functional medicine, finds the root causes of these problems and heals them using natural treatment methods. His approach has reversed diseases in thousands of patients, and he can help you too. Call the Kellman Wellness Center at 833-MD-HELP-ME for more information about how Dr. Kellman can help you feel your best. That's 833-MD-HELP-ME. Learn more about the Kellman Wellness Center at kellmancenter.com. The phone number again, 833-MD-HELP-ME. That's 833-MD-HELP-ME.
Okay, folks, welcome back. I'm here with Greer McGuiness from Vibrant Labs, giving us incredible information about hidden toxins and chemicals and pesticides in the environment that's causing or likely causing your problems, your health issues, your health conditions, your symptoms, unexplained symptoms, and various diseases that you may have been diagnosed with and only being treated superficially without really addressing the causes, which offers you the opportunity to actually reverse the disease if you target and treat the causes. That's really what my practice is all over the years, is really looking deeper, digging deeper, looking beneath the tip of the iceberg, and using the appropriate, more sophisticated tests, lab tests that can reveal some of these causes. So now we're talking about all the toxins in the environment, including heavy metals and pesticides and chemicals, and they're not only problematic and toxic individually, but when they're in combination with so many different other toxins, they could be lethal and a major cause of chronic disease. I see this all the time. I see high levels of metals and other chemicals that contribute significantly to depression, anxiety, cognitive problems, brain fog, dementia. It's really quite astonishing. And also, yes, with inflammatory disorders, autoimmune disorders, even that it could worsen diabetes as well. So the list goes on and on. Certainly developmental disorders like autism. I've seen kids that began to speak by getting rid of heavy metals like lead and mercury, cadmium, many other chemicals. So it's quite revealing and astonishing. And I just wish this information would get out to more and more people so it can actually begin to not just treat the symptoms of disease, but actually treat deeper the causes, the root causes of the problems, and give you the opportunity to actually reverse the disease. And I see this and do this with my patients day in and day out. So what tests do you recommend for all the listeners to actually evaluate and look deeper to see if they have these problems? Heavy metal toxicity, mold toxicity, and various other environmental chemicals. What is the test that should be done?
So I love doing, usually what I'm going to start always doing is a gut zoomer, our gut zoomer stool test, and a micronutrient test. And the reason why I also add those two in before I even sometimes do a toxin panel or in conjunction with a toxin panel is because the gut is the engine to the car. Your gut runs the whole entire system. So, you know, Hippocrates says all diseases begin in the gut, and he's 100% right. Once we start correcting micronutrient deficiencies and the microbiome, the body starts working more efficiently and effectively. So we can then tackle any type of heavy metals and mycotoxins and environmental toxins. People really underestimate that if we don't have our beneficial microbial species like our lactose and our bifidose, those are actually what helps detox heavy metals. They neutralize heavy metals in our system. They help remove mold and environmental toxins. Our micronutrients help our liver to detox those toxins. It helps make bile to move out those toxins as well. So go ahead. Sorry.
Which micronutrients are you referring to?
So I do our intracellular and extracellular micronutrient panel. It is a full blood draw. It is one of the most effective tests I think I've ever seen in over 15 years of practice. It is essentially by far, you know, you were saying, you know, when you go to a doctor's and you're trying to figure out what's wrong with you, they do a bunch of blood work and it all comes back normal. And how frustrating is that for so many patients? Because when they're looking at blood, many times they're only looking at the serum. So that's a very short time frame, about 24 to 48 hours. You're, you know, seeing, oh yeah, you did great with your vitamin A and your B's and your vitamin C looks great. But if you look also intracellular at the white blood cell level, which is what we look at, that's your storage. And many times it could look great on the outside, but on the inside, it doesn't look so great.
And what nutrients are you testing for inside the white blood cell, inside the cell? What nutrients?
Oh, we're testing all your B's, vitamin A, C, all your minerals, amino acids, and all your antioxidants, your omegas, pretty much almost everything.
which minerals and which antioxidants?
So we're testing glutathione, we test vitamin C, vitamin E, we're testing manganese, magnesium, zinc, copper, selenium. We're testing all your omega-3, omega-6, all your B's, all your vitamin D, D2, D3, 25-OH, etc.
Right. As opposed to regular labs, that even if they're doing vitamin levels, it's not in the white blood cell or red blood cell. It's actually just in the serum, like you said. What about gut about the gut test, the microbiome evaluation. What do you typically find in these stool samples in terms of the microbiome evaluation, and what do you do about it?
I will definitely see a lot of inflammation, a lot of inflammatory markers. A lot of the times I will see overgrowth, candida, other types of pathogens and parasites that, I call them our unfriendly, unwelcome guests in our home. I will see a lot of low bile and pancreatic lactase. So that means your body is not digesting and absorbing your nutrients properly. We'll see a lot of elevated zonulin, which is leaky gut.
I'm sorry, deficiencies of what from the liver?
Bile acids. We'll see low
bile acids. And you test for bile acids as well.
Mm-hmm. Yep. And
okay. And based on and then are there particular bacteria that you tend to see deficiencies in?
So typically I will see a lot of deficiencies in our what we call short chain fatty acid producing microbial species, and those are food for our beneficial microbial species. So remember, those little microbes in your gut need to eat, and what they eat is resistant starches and short chain fatty acids. So if we're not getting that in our diet, they don't have anything to eat, so they can't thrive. So they kind of die off, and then those pathogens get to overgrow.
And how would you increase these short chain fatty acids?
So we encourage something called resistant starches. So this is something that is a very common occurrence in certain foods. So potato starch, raw green banana flour, which is amazing, especially if you love smoothies, cooked and cooled rice, legumes, chickpeas. So some of these things are, if you're on a specific diet, like if you're on keto or paleo and you don't eat any of those types of grains, you could have really low resistant starches intake, which would decrease your short chain fatty acids.
So raw green banana
flour.
Where do you get such a thing?
You can actually get it from some health food stores. I have seen specialty health food stores carry them. You can get it from Amazon too. I've definitely seen it there as well.
And you just put the powder in a drink, in a smoothie or something.
Yeah, you can add it right. You can't bake it. If the moment you cook with it, you kill the resistant starch.
Right.
So
what about inulin, which I recommend, inulin, arabinogalactans, which are prebiotics? Would that help with
like berberine? Yeah, so with inulin, I think inulin is a great product. The only problem is that if you do have candida overgrowth or a yeast overgrowth, it actually can feed the yeast overgrowth and make more of an issue. So usually what I do is I make it, or I get it into a supplement that already has it in it for a little bit and just see how a patient can tolerate it and then move up accordingly.
So what else besides inulin?
Berberine. Berberine is great too. You can do straight butyrate supplements.
Right, which I recommend.
Butyrate. There's
what about apopectin and cassia and things like that?
Yeah, you can definitely do that as well. Yeah, Body Bio is another favorite company that I have, and they make a butyrate supplement too that I use often.
Right. Yeah, they're good. And what types of bacteria do you tend to see deficiencies in?
So a lot of times I'll see really low Akkermansia. So Akkermansia is a really beneficial microbial species that lines the gut lining. It's kind of like a protective mucosal layer. And I will see that low a lot of the times when people don't eat enough polyphenol foods. So those bright colored, flavorful fruits and vegetables, and that can be really damaging to the microbiome. So I definitely do see low levels of those. I see a lot of low levels of different types of lactobacilluses and bifidos, especially just simple things like acidophilus, like that lactobacillus acidophilus a lot suffers, and that's a very robust beneficial microbial species.
So you frequently recommend taking a probiotic?
For a lot of the patients, I do. If they're not taking one and their diet really isn't up to par, what I really do try to do is work with patients, because eventually patients will kind of get tired of taking pills. And I understand that it's a common occurrence. People take it for a while and they get better. And then after they get better, they kind of die off and they don't want to take them anymore. So I really do work with different types of like fibers and prebiotic fibers, like psyllium husk and chia seeds, flaxseed. I start teaching them to incorporate these types of prebiotic fibers into their diet, so that it just becomes second nature, so that they can start building up their beneficial microbes on their own.
That's true. Let's take a break for 1 minute, and then we'll come right back.
You are listening to MD Holistic Healing with Dr. Raphael.
Tonight's broadcast of MD Holistic Healing is brought to you by Vibrant America, providing patients with life-transforming laboratory services. Vibrant America is the leading science and technology company delivering life-transforming laboratory services. Vibrant's vision is to enable symptom-based diagnostics and prognosis for autoimmune disease and other chronic diseases using an integrated microarray platform that would enable multiplex testing at an affordable cost. Founded by technologist scientists, our science-driven approach has resulted in numerous products and services in a range of diseases, including allergy, autoimmune like celiac, connective tissue, rheumatoid arthritis, and infectious diseases. We offer a robust menu of clinically relevant tests in various disease areas to accommodate all your healthcare needs. Vibrant America is committed to providing the best services and a clinically relevant menu of testing options to accommodate healthcare providers and their patients. Find out why more and more physicians are using Vibrant America. Ask your licensed healthcare professionals to order Vibrant Wellness Laboratory testing for your peace of mind.
Well, that's great. So,
Go ahead.
welcome back. Welcome back. I think we have another few minutes. So again, Greer, so you recommend the gut zoomer, the stool test, the micronutrient levels. That's a blood test. And what would be the next test? Is it a urine test to measure for toxins and metals?
Yeah, I usually will definitely add in the toxins with the gut zoomer and micronutrients, because I can't detox if the system isn't working. If you're not stooling every day, we deal with a lot of patients who have constipation. They don't go every day. And that could be a definite problem when you're trying to detox any type of toxin out of somebody, because we don't want it getting reabsorbed. So we want to make sure things are flowing. We want to make sure that bile is flowing. And then when we get to see all those toxins, we can create a plan. We take the urine for the total tox. We'll look at all your heavy metals. We'll look at any type of potential mold exposure.
And so that would be the urine test that measures for heavy metals, and then also the blood. So the mold and all the other toxins could all be from urine. Is that correct?
It's all urine. Yep, strictly
Okay.
urine. So urine is the mold, the mycotoxins, the heavy metals and environmental.
And even though urine is kind of only showing, kind of acute exposure, when you combine that with the micronutrient levels, you can figure out if the heavy metal problem has been a chronic problem.
Yeah, we could definitely look to kind of see, when we start seeing some levels, and they might not trigger in a high, they might be a moderate level in your urine. But when there's some, there's more, unfortunately, because like we said, they hide. So if we are catching them, if we are seeing them, there usually is going to be more of it somewhere in the system, whether it be in the brain, in the bones, or in the organs.
Right, but if you're not picking it up in the urine, that doesn't guarantee that you don't have it stored in tissue.
No, unfortunately, I wish there was something that was 100%, accurate. Unfortunately, it's a very hard way of trying to pinpoint exactly what it is. So there are times where I've seen heavy metal tests come back negative, and I've worked with a person and I've still done a heavy metal testing, and I've seen many significant improvements from that.
Well, what are your thoughts about the heavy metal provocation test, where you do actually an IV of EDTA? It pulls some of the metals out that's stored in tissue, and then you collect your urine. I know you guys don't do that test because that you have to go to a doctor that does it. But what do you think of that test?
Well, you can provoke without doing IV chelation. You can still give oral EDTA. You can do zeolites and other types of things. And, I've had practitioners that provoke. Our test is an unprovoked test. It is ranged for that. But I've had many practitioners that do a provoke test to try to push out what's already in the system and to see if there is.
And then it's collected in the urine.
Correct.
So then you could see a little bit deeper. Is there a particular dose that you recommend? I mean, there's all different types of dosages that you can take.
It depends on the supplement, depends on the person. Usually when you're provoking, you're trying to provoke to get something out, which means that you're kind of upping the dose and usually doing a higher dose for a shorter period of time. And depending on your patient, it depends on how much they'll be able to tolerate.
So do you think if you do, let's say, 500
listening
milligrams,
to this episode.
I think we only have a minute left. But listen, Greer, it's great to have you on from Vibrant Labs. I love the Vibrant Labs. I encourage our listeners to get tested, to see what's going on deeper in the body, to be able to prevent disease, but also to know the causes of why you're feeling the way you do and why you have the diseases that you may have. So, Greer, thank you so much for being on. It's been very, very helpful.
I appreciate it.
Great. All right, Greer. All the best.
America is the leading science and technology company delivering life-transforming laboratory services. Vibrant's vision is to enable symptom-based diagnostics and prognosis for autoimmune disease and other chronic diseases using an integrated microarray platform that would enable multiplex testing at an affordable cost. Founded by technology scientists, our science-driven approach has resulted in numerous products and services in a range of diseases, including allergy, autoimmune like celiac, connective tissue, rheumatoid arthritis, and infectious diseases. We offer a robust menu of clinically relevant tests in various disease areas to accommodate all your healthcare needs. Vibrant America is committed to providing the best services and a clinically relevant menu of testing options to accommodate healthcare providers and their patients. Find out why more and more physicians are using Vibrant America. Ask your licensed healthcare professionals to order Vibrant Wellness Laboratory testing for your peace of mind.